Hello, I'm with Dr. Gregory Buford, a graduate of the Baker Stuzin Baker Cosmetic Surgery Fellowship in Miami, making him one of the few cosmetic plastic surgeons in the Rocky Mountain region to complete formal postgraduate training. Dr. Buford holds higher degrees from the Georgetown University School of Medicine and the University of California, San Diego. Dr. Buford specializes in non-invasive and cosmetic plastic surgery procedures. A nationally recognized expert and trainer in safe and effective use of injectables, Dr. Buford is renowned for his expertise in breast enhancements. He has performed more than 4,000 breast-related procedures over his career. He is also the lead author of Beauty and Business, which was first published in January 2010. Thank you, Dr. Buford, for taking time off your busy schedule to do this recording for Doctor's Choice Awards. Let's move to our first question. Congratulations to you, Dr. Buford, on being the city winner of the Doctor's Choice Awards in Plastic Surgery 2015, Englewood. How excited are you on winning this award?
When I first learned that I won the award, and actually it's not me that won the award, it was actually myself and my staff, but we were very excited and honored to be the recipients of this acknowledgement. So very excited.
You have received great reviews from your peers in the industry. What was your first thought on Doctor's Choice Awards?
Well, I was very impressed that this new site actually was developed for addressing peer-to-peer reviews. I love the fact that you're able to comment on leaders within your own industry, and the fact as well too that this is not a popularity contest. This is actually based upon meritorious reviews from other physicians, and not simply as many of these sites are, who happens to work at a specific hospital. So I was very honored. Again, I was very honored to have other peers who I have mutual respect for as well too call out our practice in a very positive way and acknowledge the fact that we have given back to our patients in regards to great results and hopefully great customer service as well too. So again, it was a great honor.
What conditions are commonly treated by you in your office? And what do you believe sets you and your practice apart from others?
Well, surgically, the number one thing that we actually treat is breast enhancement, or addresses breast enhancement. We work with a number of patients for primary enhancement. That's a first-time breast augmentation or breast augmentation and lift. We also work with a number of patients as well too for secondary breast augmentation, and that is revising a result that over time is either not held up or that was never really the result that they were looking for. My practice also offers a number of other options as well too that are non-surgical. We offer Thermia RF technology, which is a non-invasive heat-related ability to tighten skin and shrink fat. We offer all the basic injectables, Botox, Juvederm, Voluma, and such. Also offer Sculptra as well too. We offer medical skincare. We offer essentially surgical means to address what we can do surgically, and then we also address the fact that there is a rapidly growing interest in non-invasive means for areas such as again skin tightening, body contouring, as well as facial rejuvenation. So we're looking at what patients are asking for, not only within the U.S. but also abroad, and trying to deliver them in as effective and as efficient means as possible.
How long have you been established in your practice, doctor, and what kind of culture have you created in your practice?
I've been in practice for 15 years. A majority of that was actually in a group practice. I now actually am solo. We went solo latter part of 2015. The type of culture that we've tried to create is a very patient-centric culture. This is reflected in my previous book that I released back in 2010 called Beauty and the Business. And this was a book essentially geared towards teaching the importance or emphasizing the importance of a customer-centric practice. Why is this important? This is important because this is something that we never learn in medical school. This is something that I learned over the years. My father had his own business as well too, and so I learned that you really delivering just a good product isn't enough. In this day and age, your best marketing is not only creating a great product, an end product, but also delivering a great customer experience along the way. So what we've tried to look at is how can we actually deliver this and create an experience for the patient that is completely different than the experience they'll get from any other practice. And in the end, that has been the most effective way to get the word out about our practice, because we don't pay anything for this. This is something that we treat other people just like they would like to be treated. We try to anticipate their needs. We try to exceed their needs. Instead of putting up a fancy billboard, I would much rather deliver, again, a high-end, quality customer service experience to our patients and have them actually spread the word, and they do. So ultimately, this has proved very beneficial for us, and it's a model that I'm seeing a lot of people actually incorporating into their practices as competition increases over time.
As a plastic surgeon, you have helped thousands of women and men look their very best. What do you believe defines the term beauty?
It's a good question. That's a very hard question to answer. I think, to say that beauty is in the eye of the beholder is to simply repeat an old phrase. But I think beauty is more a feeling. It's very intangible to me in the sense that you really can't put an actual definition on beauty, because what's beautiful in one face or one body may not be beautiful in another body. But I'd say it's one attribute that defines the essence of a person. In other words, is it the appearance of their neckline? Is it the appearance of their facial shape? And for everybody, it's very different. And in reality, this is why it's very different, or very difficult and very challenging within my field to accomplish great results that are very natural, because trying to mimic what we've seen in the past, that's actually very easy. There's a lot of people that will simply do that through measurements, through pre-formatted and prefabricated ideals of beauty. That's the easy way, okay? To try to actually capture the beauty, and there's beauty in everyone's face. There really is. There's beauty in everyone's face, and to really identify what that specific aspect is that's beautiful about a specific person, that's the challenge, and therein lies the rub. That's the challenge that you have to identify in every person, and that's what differentiates the good plastic surgeon from the less experienced plastic surgeon.
As to my understanding, you effectively balance the role of being a great surgeon, an educator, an author, an advisor, and etc. How do you do all this together? I mean, how do you find the time to do it?
That's a great question. And in all reality, or in all honesty, it's actually very easy. And the reason being is everything that you just mentioned actually plays into each other. All those roles, the author, the artist, the surgeon, the advisor, all these things actually help strengthen all the other integral parts of what I do in my life, both personally and professionally. As an advisor, I'm able to interact with peers from across the U.S. and also across the world as well too, and stay on top of the latest trends, and actually bring to my patients information that is, for many practitioners, is simply not accessible. Does it take time away from my schedule? Absolutely. But in doing that, it also helps me to educate myself in a practical way that, again, helps me grow my practice. As an author, it forces me to stay on top of my field. And by doing this, I'm able to do just that, stay on top of my field and offer my patients the very latest and greatest. And at the same time, I'm able to do something that is very important and very valuable to me, and that's educating other people, whether it's consumers or other medical professionals. So I think all these things that I do in my personal and professional life, again, they're all interconnected. If they were very different or they were very, if they were not interrelated, then the time necessary for them would be, I'd say, next to impossible. But the fact of the matter is that these are so interconnected that I think they actually really help me become a stronger physician and provide better services to my patients overall.
Do you believe collaboration and networking among doctors through services and programs such as Doctor's Choice Awards plays a significant role in the success of a modern medical professional?
I absolutely do. I think that online collaboration between not only plastic surgeons to plastic surgeons, but also among all the core aesthetic specialties and even beyond, I think is something that is gaining in popularity and something that will definitely strengthen medicine in the long run. I use a number of platforms, such as Doctor's Choice, to interact with other physicians, to collaborate with them, to ask them questions. This makes me a stronger physician. I think the challenge of private practice is that you're really, in effect, on an island. I practice alone. I'm a solo professional, so whereas I see my staff and I see other medical professionals when I'm in the operating room, when I'm not in the operating room, I'm very much isolated. And so being able to collaborate with other professionals on various sites, such as Doctor's Choice Awards, does allow me the ability to integrate better with the professional community on a nationwide, as well as on an international basis as well too, and to become a better professional and better physician overall.
Do you plan to take your practice to the next level, or rather, what are your future plans?
I never want to slow down. I enjoy what I do. I would be bored keeping it the same level. My goal is to continually expand my practice, but that doesn't mean make it bigger. It means refine it, make it more, make it better for my patients, offer procedures that are even more efficient and more effective. I'm going to be adding on more of a nutritional component with the release of my upcoming book, Eat, Drink, Heal. This is something that we've already integrated into practice, but I hope to take it even further, and as well as incorporate more non-invasive technologies into what I offer patients on a daily basis. So how I practice currently in 2016 is most likely going to be very different than how I practice in 2017 and beyond. And I look forward to the challenge. I've got the best staff in the world, so I know that we as a team will be able to meet these challenges head on, and again refine what we do and offer not only better results, but even more comprehensive and more outstanding customer service to our client base.
Thank you once again, Doctor, for being with us at Doctor's Choice Awards.